If you struggle with painful arthritic knees, you might worry that exercise is going to make your knees worse. But massive new research not only shows that exercise is good for you, it shows exactly which exercises are best for safely reducing knee pain and stiffness. So in this video, I'm going to simplify this and other research down and show you 4 easy exercises that you can do at home that'll make your knees feel better than they have in years, but without medication or surgery. There are 4 steps to healthier pain-free knees for people with arthritis. And the first step is stimulating the cells that increase the thickness and quality of the cartilage that you still have left in your knees. Gentle cyclic motion is the best way to do that. Cyclic motion is low-impact, repetitious motion, and examples of this include cycling, swimming, cross-trainers, and gentle rowing. But there are some important guidelines here. The recommended amount of these cyclic motions is 15 minutes a day to allow time for the cartilage to recover. The exercise should be moderately paced, not fast or hard. A small amount of pain is okay, but should be kept at a maximum of 3 out of 10 on a pain scale. And more rest days should be included if there's any signs of swelling. The massive systemic review into knee arthritis recently rated cycling as the best exercise at reducing knee pain, but other forms of exercise like aquatic exercise weren't too far behind. So just choose one that you like and are more likely to keep up with, because consistency is the key. The next step is to maximize the mobility of our knees. As knee arthritis progresses, we tend to lose the ability to fully flex and to fully straighten our knees. And simple daily tasks can become challenging and frustrating. So here's a simple way to keep your knees mobile. Sitting on the front of a chair, straighten out your knee as far as you can with your foot on the ground, and then squeeze your quad muscles for 3 seconds to try to straighten your knee out a bit more. Then use your hamstrings to bend your knee as much as it can go. Here you can use your hands to gently assist. Using your quads and hamstrings helps to strengthen important muscles around the knee. Keep any pain to within 3 out of 10 on a pain scale, and if your hamstrings cramp up a bit, just use your hands to assist the knee bend more. Repeat 10 times in each direction daily. Step 3 is strengthening. Strengthening is a major component of reducing arthritic knee pain. And resistance training was one of the highest pain-relieving forms of exercise in the recent study. But you need to strengthen in a way that's gentle on the knees. A special knee-friendly chair squat is the best way to do this. Don't squat by just bending your knees forward, as this puts a lot of pressure on your knees and can hurt. Instead, imagine your feet and lower legs are in concrete and you can't move your knees forward. So instead you have to bend at the hips. You should feel that your weight is more on the heels of your feet, not at the front of your feet. Squat down slowly over 4 seconds. Try to just touch your backside gently on the chair and then stand up more quickly. Only bend as far as is comfortable for you, even if you only reach halfway. And if you find that difficult or painful, just hold a light weight, like a litre of milk, out in front of you as you lower down. This puts your weight more on your hips, taking pressure off your knees. If your knees still hurt a bit, make sure that your knees are positioned directly over your toes and not bent in or out too far. Repeat that until light fatigue 3 times a week. The final step to avoiding years of knee pain is strengthening the stabilizing muscles around your knee. Balance exercises on one leg not only strengthen the knee support muscles, they also strengthen the outer gluteal muscles that stop your knee from turning in and grinding. And this is part of the reason why yoga rated highest in the recent study at reducing stiffness and increasing the function of knees. An easy way to strengthen your knee stability muscles at home is to stand in front of a sturdy sofa or kitchen bench on one leg with your knee slightly bent and balance for 30 seconds on each side. As that becomes easier, begin to raise and lower the other side of your pelvis slowly to increase the challenge. If you find it a bit hard to start off with, just try standing with one foot in front of the other in a line. For more information on what supplements can help, things to avoid, and whether things like running, heavy weight training, and tennis are okay for arthritic knees, watch this video next.